We encourage our patients to be sure and make their twice-a-year visits, semi-annual visits. And on those visits, not only do we do the complete oral exam, but we treat the gum tissues and the teeth in a manner where we can remove any of the deposits that have collected. It's what we call a periodontal therapy provided by the hygienist. It's essential in that without thorough cleaning of those areas, we see recurrent, what we call periodontal disease. And what that means is that over time, patients can begin to lose the bone that's around the roots of their teeth because the teeth aren't properly cleaned. That bone is not replaceable. And over an extended period of time, if there's excessive bone loss, we begin to see mobility in the teeth and ultimately loss of teeth. So it's our goal at our office to prevent that in any way possible. And one of the ways that we do that is through those routine visits to see the hygienist, where they remove those deposits, and also, more importantly, inform the patient in the things that they can do at home to help prevent those areas from recurring. That's one of the most essential things or treatments that we can provide to patients. One of the things that dentistry has begun to do on a regular basis is to perform oral cancer screenings for our patients. And again, that's because we're intimately familiar with what the inside of the oral cavity should look like when it's healthy, and also can recognize when it's not healthy. Oral cancer is one of the top 10 cancers in the United States. There's typically about 30,000 cases diagnosed a year and 3,000 cases of death attributed to oral cancer. And just like any other cancer, oral cancer is much more successfully treated if treated early. In fact, statistics show that there's between an 80 and 90% decrease in the death rate in early diagnosed cancers. We do that by a visual exam and palpation, and in our office we also use something called goggles. We shine a particular kind of light on the oral tissue, and with the goggles that we wear, it helps us diagnose and recognize cancer at a much earlier stage. And again, early detection means more successful treatment. I've actually had several patients that we've diagnosed oral cancer. Anytime that we notice anything that looks suspicious, we immediately refer them to an oncologist, a cancer specialist, and leave the diagnosis and further treatment up to that physician. But I've had several patients that we've diagnosed, sent to the oncologist, they've been treated, and thankfully all of them have been treated successfully to this point.